This medication is used to treat or prevent bacterial eye infections. It contains neomycin and polymyxin, which are antibiotics that stop the growth of bacteria, and hydrocortisone, which reduces swelling. It treats and prevents only bacterial eye infections and will not work for other types of eye infections. It's important to use it only as directed to avoid decreasing its effectiveness. The daily dosage and optimal timing for this medication should be determined by your doctor. When using the eye drops, wash your hands first. To avoid contamination, do not touch the dropper tip or let it touch your eye or any other surface. Shake the bottle well before each dose. Tilt your head back, look upward, and pull down the lower eyelid to make a pouch. Hold the dropper directly over your eye and place one drop into the pouch. Look downward and gently close your eyes for 1 to 2 minutes. Place one finger at the corner of your eye, near the nose, and apply gentle pressure. This will prevent the medication from draining out. Try not to blink and do not rub your eye. Repeat these steps for your other eye if so directed and if your dose is for more than one drop. Your dosage is based on your medical condition and response to therapy. Do not rinse the dropper. Replace the dropper cap after each use. If you are using another kind of eye medication, such as drops or ointments, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. Do not use this medication more often than prescribed or for longer than 10 days unless directed by your doctor. For the ear drops, use as directed by your doctor, usually 3 or 4 times a day. Do not use this medication more often than prescribed or for longer than 10 days. The ear canal should be clean and dry before using this medication. Before using, hold the container in your hand for a few minutes in order to warm it. This will minimize dizziness. To apply ear drops, wash your hands first. To avoid contamination, do not touch the dropper tip or let it touch your ear or any other surface. Shake the container well before using. Lie on your side with the treated ear upward. Hold the dropper directly over the ear and place the prescribed number of drops into the ear canal. To help the drops roll into the ear of an adult, hold the earlobe up and back. For children, hold the earlobe down and back. Keep the head tilted with the treated ear upward for 5 minutes, or insert a soft cotton plug if so directed. Another way to give this medication is to place a cotton wick in the ear canal and moisten it with the prescribed number of drops as often as directed. The wick should be replaced at least once a day. Repeat the above steps for the other ear if so directed. Do not rinse the dropper. Replace the cap after use. Use this medication regularly at the same times each day. Continue to use this medication for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Inform your doctor if there is no improvement in your condition after 2 days of treatment with this medication. When you apply this medication, you may feel a temporary stinging or burning sensation in your eye or ear for a short time. If this feeling continues or gets worse, make sure to speak with your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they believe the benefits to you outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Using this medication for a prolonged period of time or repeatedly may lead to a new fungal eye or ear infection and could increase your risk for other eye or ear problems, such as glaucoma, cataracts, or hearing loss. It's essential to only use this medication for as long as your doctor has prescribed it. If you experience any new or worsening eye or ear symptoms, vision or hearing problems, or eye pain, be sure to contact your doctor immediately. While a severe allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as a rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not mentioned, make sure to get in touch with your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA, and in Canada, you can report them to Health Canada. Before starting this medication, make sure to inform your doctor or pharmacist if you have any allergies to neomycin, polymyxin, hydrocortisone, aminoglycoside antibiotics, or corticosteroids, as this product may contain inactive ingredients that can cause allergic reactions. Also, be sure to inform your medical history to your doctor or pharmacist, especially if you have other ear or eye problems. If you are using this medication to treat your eyes, be aware that your vision may become temporarily blurry or unstable after applying the drops. Avoid driving or using machinery until your vision has stabilized. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. Remember to always follow the instructions of your doctor or pharmacist when using this medication. When taking Neomycin-Polymyxin-Hc suspension, drops, final dose form, it is important to be aware of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. It is important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. Remember, your doctor knows best when it comes to managing your medications. If this medication is accidentally swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek medical help immediately. In the US, you can call 911 for emergency assistance, or contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important to remember that this medication is meant for your specific condition and should not be shared with others. Once your treatment is completed, make sure to throw away any unused medication and do not use it for another infection unless directed by your doctor. If you are using this medication for an eye infection for 10 days or more, it's important to have regular medical tests, such as eye exams, while using this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. For those using this medication to treat an ear infection, it's crucial to keep the infected ear clean and dry. Try to avoid getting the infected ear wet while bathing and refrain from swimming unless advised by your doctor. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store Neomycin-Polymyxin-Hc suspension drops at room temperature, away from heat and light. Avoid storing it in the bathroom and keep it out of reach of children and pets. When you no longer need the medication or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of the product. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.